is perhaps not a familiar face because she's a part-time student, but she has been with us since the UWS days. She has a very interesting, very different PhD for us. So if you're ready.
Yes, yeah.
If we can, no, we move, but if we do have to get it moved, we'll avoid the camera area.
Yep. Okay, so before I start, I'd like to show my respect and acknowledge the traditional custodians of the land of Darug people of the Eora Nation, and also to pay respects to elders past and present on which this event takes place. So, welcome to my CSA presentation this morning. I'm looking at researching OT assessment with Indigenous people within the clinical area of mental health, which is where I work. So I think before I start, I'd like to start off with a bit of a story which really made me think about researching in this area. So I work on a psychiatric inpatient unit at Concord, and I was working with a particular client who had come in, had been admitted to hospital. He'd been admitted to hospital several times, and one of my colleagues had, each time that this particular is an Indigenous man, I should add, every time this man had come in for an admission, he'd come in without enough clothes, enough shoes to sort of keep him going throughout the admission or even post-admission. So by the third or fourth admission, my colleague was saying, like, this guy can't manage his money, he can't look after his things, he's actually functioning really poorly, and I think that we need to give this guy some help, a lot of help, in being able to basically manage these basic tasks. When I sat down with this man, I kind of came to understand that actually he was quite pleased with where he was at, because when he'd come into hospital and he'd got that help to organise things like shoes and clothes, he was able to go home and fulfil a role that was expected of him within his family and kind of extended family and social group. So he was actually quite happy with where he was at and functioning really well within his kind of milieu, I suppose. So I think potentially if that wasn't correctly assessed and picked up, there was a lot of potential for negative outcomes in terms of treatment and service provided to this man. I think potentially that negative stereotypes about Aboriginal people were potentially reinforced amongst the treating team and documented and possibly sent on to other services that he was going to be referred to. I think that also the team could have thought that he was actually more unwell psychiatrically than he was, possibly increasing treatment where it wouldn't have been necessary in terms of medication, treatment. And also referral to services that were inappropriate. So referring him to services with a high level of support than he actually needed. And I think that also has a follow-on effect of engagement with services following that. If that person can't see a point of engaging with mental health services because they're not meeting the needs, then they're probably not going to engage now or in the future. So this is what kind of led me to think about research in this particular area. I think there might be an element of sort of lost in translation with this presentation. OT is only a small profession, and so I think, especially in a 20-odd minute presentation, it's hard to get across the depth and all the concepts that are within the profession of occupational therapy. But I think the main thing that I'm trying to get across is that through this research, overall really I'm aiming to look at improving services as well as treatment and outcomes for Indigenous people when they're using mental health services. So some really important background fundamental elements to the research. Mental health. For our Indigenous people, this is interpreted as social and emotional health and wellbeing. So we're not just looking at mental health diagnosis and symptoms, we're looking at social connection with community, we're looking at the quality of the connection with the community, and an overall sense of health and wellbeing. It's holistic. This is versus the more traditional Western understanding of mental health and health in general, for that matter. So breaking people down to diagnoses and symptoms. So really treating the person as separate to their social and cultural environment and focusing on symptoms. And I think, which I'll talk about just after this, I think the statistics reflect the problems of trying to fit people with very different concepts of health into the mainstream system. And I think the poor statistics in terms of Indigenous mental health reflect that. So just a few statistics. 2012 and 13, Indigenous people were admitted to inpatient facilities at double the rate of non-Indigenous people. And they were seen by community mental health services at around 3 times the rate. So these are just people that are actually seen by services. That doesn't capture people that haven't been seen by mental health services. And we know that there's a lot of reasons why Indigenous people can be reluctant to engage with mainstream health services, including mental health, for historic reasons. And interestingly, this is from the actual viewpoint of Indigenous people, so self-reporting their own status of mental health. In the Aboriginal and Torres Strait Islander survey of 2013, Indigenous people, roughly a third of those responded had experienced very high levels of psychological distress during the 4-week period before the survey. So that's about 3 times the rate of the rest of the population. So that's a big discrepancy, I think, in those statistics, and that's only a few, there's a lot more. So where does OT, mental health and Indigenous people come together in terms of this research? So there's no literature from the OT perspective, within OT literature, on ways of working, some specific ways of working, assessments or procedures in the clinical area of mental health with Indigenous people. There's some vague guidelines about how you would work with Indigenous people, being respectful, taking extra time if you can, engaging with family and extended family, etc. But what the literature is very clear about within OT, within the OT profession, is that OTs are asking for something that makes them feel like they really are working in a culturally appropriate manner. They're asking for it, but it doesn't exist, or to the extent that they would like it to be. I just want to give you a bit of an idea about what actually OTs do in mental health before I go on to OT, mental health and Indigenous people and that kind of process. But just to give you a bit of an idea, we're looking at functioning. So mental illnesses typically affect somebody's functioning. So down to the day-to-day sort of activities of daily living. So waking up on time, getting a proper sleep, levels of organisation and disorganisation, and ability for someone just to be able to do those basic tasks on a day-to-day, week-to-week basis. And by the way, when we're talking about mental health issues, we're talking about things like schizophrenia, depression, bipolar disorder, those kind of diagnoses. The OT really needs to look at what the person does every day to give their life meaning. What is it that person wants to engage in every day, every week? What is it that gives them satisfaction and a sense of well-being? And what happens to our sense of self when we can't do these things because of the impacts of the particular illness? So that's just what I said there. So elements that shape what we call the valued roles are the things that give our life purpose, the roles that we want to engage in. So there's many things, but two of the kind of most important things are what the expectations are of the social environment and the cultural environment. So, for example, here, for a lot of people, being an employee is a valued life role, something that gives us a sense of meaning and purpose. That dictates what activities and tasks we're going to engage in every day. So if we want to go to work because we value that role, we're going to need to have to get up on time. We're going to need to be able to drive a car, catch public transport. We're going to have a reasonable set of communication skills. So there's a set of things that we need to do which having a mental illness impacts on. For example, if you're depressed, you're having a lot of trouble getting out of bed in the morning on time. You're having a lot of trouble thinking clearly, organising your day, getting yourself prepared. So this is where the OT focus for intervention is. So we work with the person on those activities and tasks needed to fulfil the requirements of that role. If the person is able to achieve those activities and tasks to a satisfactory level, they're completed satisfactory and they're able to achieve a sense of well-being and satisfaction. If not, we lead down here, this arrow here, to a loss of purpose and a sense of hopelessness. And if you're depressed, for example, that's going to impact even more and have more of an impact on your sense of well-being and probably make you feel a lot worse. So, with the example I spoke about at the beginning, my colleague had assumed through their own cultural filter that financial independence is what you would expect of a young man of this age to want to achieve. So the sort of activities and tasks that she set about working on with this person is managing a budget, banking, paying bills and rent. Quite individualistic kind of tasks, things that we can do on our own. However, in the first place, the correct role was never identified. The assumption was that this person would want to work on financial independence. So we, by targeting the wrong tasks and activities, the person is not going to successfully complete the role that they actually want to complete. And so we're probably going to reinforce this loss of purpose, sense of hopelessness, and a negative impact on well-being. Because the interventions don't match the activities and tasks the person wants to work on, which is related to their actual valued role. With the correctly identified role, sitting down with the person, with this gentleman afterwards, myself, I came to understand actually the role that the person wanted to achieve was financial interdependence. So being interdependent with the rest of the family and the wider extended family and group. So then that leads to being able to identify the correct activities and tasks that person wants to work on. So contributing to the finances of the family group and sharing goods and food. That's what made this person feel really good, because they were able to carry out tasks related to the correct role that they wanted to engage in. So by working on the right activities, we can achieve that sense of well-being and satisfaction. And if those correct activities hadn't been identified, we would have gone down this path to the loss of purpose and sense of hopelessness. So just to reinforce the point that correct assessment needs to happen at the beginning here to correctly identify the roles. And that's why this research will focus on developing and a culturally appropriate assessment tool. Okay, so the expected outcomes of this research. The gap filled by the research is that this research sits at the intersection of OT assessment, mental health care and Indigenous people, which there is no current sort of research in this area. We know OTs want more guidance in this area, there's no research in this area, and I think that, as I said before, the statistics show a really dire need for intervention in the area of mental health. And I believe that better OT assessment within mental health services will contribute to better outcomes for Indigenous people. So the implications for Indigenous people of inaccurate assessment. We're looking at possible results of ineffective and negative outcomes. As I said, if the person gets to that sense of hopelessness after an OT has tried to intervene with them in the incorrect sort of way, that could actually lead to a decrease in functioning or a worsening of symptoms, and both really. I think there's a possible reinforcing, as I said before, of negative attitudes of staff. So we're setting the person up to fail without proper assessment, and I think that's certainly. I think I would say that's something that I've seen in my own clinical work, that some of these, probably without people even noticing, the negative stereotypes have been reinforced. I think we risk failing to capture the functional strengths, and I think that has implications for referral to other settings and external institutions like housing organisations. So if we're not assessing properly, we're giving these external organisations the impression that this person is actually functioning a little worse than what they actually are. And just generally focusing on the negatives, the cannot rather than the can. And I think, particularly within mental health, we need to take a strengths-based approach, and identifying those strengths it gives impetus for the ongoing treatment. It helps that person feel better about themselves. It's more likely that you can build on those strengths and continue to develop skills. Okay, so the research aims to develop a guideline tool rather than a standardised assessment. And this is because it needs to be flexible yet specific. We know that not every person is the same, not every Indigenous person is the same, not every Indigenous community is the same, so we can't develop a very strict a standardised assessment tool, because that defeats the purpose really. It needs to be flexible enough to be used with Indigenous people from many backgrounds. However, it needs to be specific enough to fill the current gap that OTs have expressed that they're feeling in terms of assessment resources. We need to make it easy to pick up and use, nothing too complicated. I don't think having sheets and sheets of assessments and extra training is going to help with this being taken up. So it kind of makes it a bit pointless if it's too complex, I think. And I think if OTs themselves can see the benefit, there'll be a bigger chance of buying, or a wider chance of buying. So there's 3 research studies proposed. So the plan is to develop a guideline tool from the ground up. That's because nothing exists, as I said before, so it's not like I can sort of compare the use of one assessment instrument compared to another by OTs working in mental health, because they don't exist. So it needs to be developed from the ground up through research. And the methods will be about gathering the depth of knowledge from participants. I suspect that a lot of OTs are already using their own ways of working. They've developed their own I suppose, yeah, ways of working that have made them feel like they're working in culturally appropriate ways. But we need to compile them, I think, and put them into one kind of resource or document. So that's what the research will be about. So the first study, I'd like to find out how well ITs feel that the training, undergrad training and the resources have made them feel like they're prepared to work in a culturally appropriate way with Indigenous people. To understand from OTs what they feel they need in order to be more confident in that area. And to determine how well ITs feel the current assessment methods incorporate social and cultural factors, if they do, if they've found that any particular assessments do meet that criteria. So not necessarily mental health, but in other clinical areas of practice. And to gather knowledge from OTs who stated that they actually have a high level of experience and confidence, and to sort of find out how they develop that and what they do that's led them to that point. So the methodology for study one, so I'll be recruiting through professional networks, snowball sampling, through the professional body, our professional national body, OT Australia, and the Indigenous Allied Health Networks, such as the Indigenous Allied Health Australia network. I'm looking at getting 100 participants across Australia in urban, regional and remote settings. And it'll be an online survey, taking about 20 minutes to complete, so nothing too lengthy. Study two, I'd like to explore in detail those OTs who indicated in study one that they were confident in their skills and abilities in assessment with Indigenous people, and how they've adapted any current tools that they're using to make them more culturally appropriate. So people were recruited from study one, people who have indicated that they're happy to participate in study two will be recruited from study one. We'll include some purposive sampling. I think that this particular group of people won't be huge. As I said before, OT is a pretty small profession, and that's quite a narrow criteria for recruitment for this study. So I think it'll be a fairly relatively small sample, but with a lot of depth of knowledge. And that will be in the structure of a semi-structured interview. I'd like it to be, my plan would be for it to be more of a narrative kind of, so I don't want to leave the interviewee and what they're trying to say. I think the challenge will be that people have embedded these techniques so much in their practice day to day. It'll be about kind of helping them to tease out those strategies that they use, because they'll be just, I imagine, so good at incorporating it automatically. And I'm anticipating about 30 minutes to an hour out of the phone. Study three. So for study three, I will be compiling all the information from studies 1 and 2 into the assessment guideline tool. So to develop the tool, based on that knowledge from those studies, and that these will incorporate those social and cultural issues that have been mentioned previously, and that they'll incorporate what's essential to be included to assess functioning within the urban, regional and remote settings, and that's why I'm trying to gather data from different geographic settings as well, so that this tool will hopefully apply. These are the participants I'm hoping to get. There's 27 in all. At the top, Indigenous health workers, so 3 from the urban, regional and remote setting. In the middle there we have Indigenous OTs working in the field of mental health. And at the bottom, non-Indigenous OTs working in the field of mental health. So the aim of getting this feedback on the guideline tool that I've developed in Study 3 is so that these experts in these fields feel like what necessitates a good functional assessment is included, but also from the OT, that's from the OT perspective, but also what makes the tool appropriate from a cultural perspective. And so that's why the Indigenous health workers, as well as the Indigenous OTs, who are very valuable because they have a kind of a foot in both camps, to make sure that those two elements are really adequately included in the new guideline assessment tool. So the participants will be asked to provide feedback on the assessment guideline tool that will be developed, and they'll be selected based on their expertise. So as I said, either OT functional assessment, cultural awareness, or knowledge of both. So it will be using a Delphi technique. So the assessment guideline tool will be sent out to these participants with a questionnaire to comment and give feedback. That feedback will be incorporated into the tool and will be sent out again to those participants until we can reach a level where everybody's satisfied that what they consider important is included in the guideline tool. So just to summarise, so don't overall that the research will contribute to more culturally appropriate assessment, processes in mental health, OT with Indigenous people, that this will produce better outcomes and overall improve mental health standards for Indigenous people who have a lower standard currently, and to provide a foundation for similar developments in other clinical practice areas and professions. And that's it. Thanks very much.
Any questions? Yeah, I'll ask the first question. With towards the end stages about getting agreement among people, you'll never always get agreement. So, are you going to draw a line somewhere? I mean,
yes. Yeah. So I think there'll have to be a standard, like a standard number or a standard number of people that have consensus. I think with each round, because you're right. I don't think we're going to get everyone that agrees every time. And I think that with each time that feedback's sought, that will probably change as well. People's feedback will change from one distribution to the next. I think there has to be a level where there's, maybe if there's, 27 people have been asked, possibly there has to be a number that's a cut-off for each round. Because we're never going to get everyone to agree.
Okay. Secondly, this is a state-based idea, isn't it?
No, I'm going to seek to get input for the studies, I think, from across the country. And I think that will probably make it easier in terms of recruitment because, as I said, not that many people will fit the criteria for selection, particularly for Study 2 and Study 3 actually. So. And I'd also like to make it something that can be used not just within the state, and I think that probably gathering that data from around the country will make that more valid.
If you're wanting to make it have a national focus, will you need to work with someone from OT Australia?
Yes.
The whole way along?
I'll need to work with OT Australia, whether it's an individual or just the organisation, but yes. And I think that OT Australia will be really keen because they have a clear mandate in terms of improving work and the quality of OT work with Indigenous people.
Yeah, I think it might be a good idea to identify one person or a couple of people that will hopefully be with it from the start to the finished. Otherwise, you get that things get lost with them.
Yes. Yeah, hopefully they'll see it as important enough. But I guess I'll see. But yeah, that would be ideal. Yes, I agree. Yeah.
Okay, yeah. Just add a comment. One thing that, because I've read the CAC document, it was good to see that's you got a very good literature review, which of course you can have time to go into it here, but it is quite a solid literature review showing that OT have the best of intentions but are lacking something like this. So for a profession who care about Indigenous people, this will be a good thing.
Yeah.
They haven't had that.
It's a big part of all of OT models and foundations for OT practice to work in culturally appropriate ways, and I think that's probably why
That's right.
there's such a demand,
yeah.
but they're not sure how to do it. I think that's why they feel it so much as a profession.
So do you think your research will be, as well as providing current OTs with a guideline, do you see your research maybe being incorporated in training of OTs as well?
Definitely, yeah. So I think certainly within mental health specific training in undergrad, but I suspect, because functional assessment happens whether it's in the mental health clinical area, brain injury, all sorts of areas that OTs work in. So I think it will be a foundation for developing similar tools in different clinical areas as well. So there's a lot of, I think, scope for ongoing research afterwards as well.
And I mean, I'm an OT educator, and one of the things that I meet with OT educators from all programs around Australia and New Zealand who teach mental health curricula, and this is like a vacuum space. And so I think and it's something that we acknowledge is necessary and important to teach our students, but we don't have something concrete that we can actually teach. So I expect that this will fill that vacuum, and because it is a vacuum, it'll be sucked up quite quickly, and it'll be practical and adopted, I think, potentially across, it won't be adopted across New Zealand, but across Australia, I think, into all the programs.
There is also research in other countries with Indigenous people as well that, could potentially, I don't know, be not necessarily directly used, but it'll be a foundation for research in places like New Zealand or Canada, where there's very strong OT research base anyway, but nothing like this, so potentially.
So the interesting thing about this project is within the field of OT, Indigenous issues are discussed a little bit.
Yeah.
Within mental health, Indigenous issues are discussed a little bit. We've got the intersection of mental health and OTs, which is something I didn't know existed until I met you. So you've got that vague in one area, vague in the other area, very vague when it comes to mental health OT.
That's right, yeah.
So just wondering, so outside of OT, I'm hoping we're doing a lot better like in mental health generally, and there'd be some tools that are not, I guess, exactly what you're looking for, but that might give you some guidance in terms of the Indigenous.
In my research, I've looked at other professions like nursing, psychology. There's a bit, but it's there's not a lot. There's been a few more sort of specific tools that have been developed, but it's not a lot of resources. Because I did think, it'd be good to have a look at how other professions have approached this particular issue, but they're quite similar in this kind of really well-intentioned...
Yeah, lots of good intentions, but less so on...
That's right, on having something that people are asking for, basically, yeah.
So what about maybe a bit more broader than in the recovery literature, which is more, I guess, have you sort of drawn on that?
Yeah, it's very much, OT theory and recovery is very, it overlaps a lot. OT and mental health theory and recovery. But again, that doesn't give us anything more specific.
Right.
It gives us a framework.
Yeah, I guess I'm thinking more in terms of, if the staff, I guess you could give anyone a tool, but then if they're coming in with stigma or ideas about people and that's not shifting, so I guess engaging them from a more philosophical or a background so that, you know, the conversations will come out the way you would hope within your assessment tool?
Yeah,
that kind of thing?
I think that's the thing. I think OTs do have the good philosophical background generally. I think that we've got that. That's really good with all our models of talk about culture being a really fundamental part of assessment and practice and everything like that. And again, I think that's why OTs feel that really strongly, that sense of I want to do it, but I don't even know what I don't know, sort of thing. That I want to do it better, but I don't know how to do it better. I need something clearer, basically. So all of that is all there. The recovery stuff, the cultural importance of including cultural practice, but how we do that is not clear.
Yeah.
I see this a little bit. I don't know whether you're familiar with Mike Slade's 100 Ways to Support Recovery. I see this as, you know, a few practical kind of strategies that can actually embed more culturally aware, more culturally appropriate kind of practice into assessment, in a way that, you know, recovery theory says all of these things and empowerment and blah, blah, blah. But how do I do it on the ground? How do I work with people? And so this kind of mirrors that approach to it.
Sorry.
Just out of, first of all, thank you, that was very interesting. And just out of curiosity, and I don't even know if it's necessary, but are there, on the long run, any plans to evaluate the instrument? Like, not just getting feedback, but also, like, talking to, I don't know if they're called patients? Or comparing it to other tools?
Yeah. So that would definitely be a plan. I think, as I said, because there's kind of nothing that exists at the moment, I think it'll be a lot of, these 3 studies are about developing the tool. So I think in terms of the evaluation and getting feedback from, the people that we're actually working with, I think that'll probably be some post-PhD work, basically. I think that would be, that would be really good to do afterwards, after we get the tool done and finalised.
With your interview data, how are you going to analyse that?
So in terms of what?
I know you're coming up to speed now with qualitative methodology, so just talking a little bit about once you get all this data to be transcribed and then...
Well, it will be about sort of looking for themes in the data about how people approach practice, and very, I think, as specific as we can kind of get. So what are the common things that these people tend to do? What are the things that people have found more useful, say, in the urban environment as opposed to in the rural and remote environment? So trying to collect themes, people in different geographic areas, as well as themes that run through the whole of the 15 interviews for study 2.
Yeah, I think if that's well documented, that will prevent what I was talking about earlier, where someone says, well, I didn't agree to that, or, I gave this idea and it wasn't taken on board. So at least if they can see that, we spoke with 10 people and 8 of them said blah, blah, blah. If you're one of the 2 who didn't, you'll understand.
I imagine that there's going to be always people that don't kind of fit in with the rest, or the trend of the rest of the participants. So, I can imagine that would be the case. So, have to look for things.
I assume that panel member, we jump right in with the questions, or we wait for them to jump right in? Okay. Going back to the literature review, you made, when we read the COC, it's very clear there's nothing appropriate for OT as adapted to Indigenous Australians. And you look a little bit outside of Australia to see what has been done, and you conclude that there's nothing directly relevant, which is true. But I think for the thesis, not at this stage, for later, you might want to look even a bit broader about what has been done, because I know that there's not a lot, but publications about to conduct culturally appropriate assessments and intervention with the First Nations in Canada, in the US. I even published a literature review 10 years ago on that, and there was quite a lot of material that's not all directly relevant, but you can extract a few principles, even if it's only to conclude that it's not relevant. I think to add value to the thesis as the end product, it will be good to show that you've covered that area also. So that's, but it was still a very impressive COC. And another thing, and I'm following up from what she said. In addition to the evaluation of the efficacy of the protocol later down the line as opposed to PhD, I think if there's one limitation to what we propose, and it's if it was just a PhD and we had the feeling that you were doing the PhD to get a degree and that was it, I wouldn't necessarily say that, but we feel that this is a PhD that seeks to have a real impact on something. And with this in mind, I think the main limitation is that you're not interviewing any of the customers of OT. And I think that's a great opportunity that you're missing. And I don't say that to say that this part needs to be in the thesis, but I think you could have a great opportunity to, in study 2, you will be interviewing OTs, and these OTs will tell you that, you will select OTs that tell you that, yeah, I'm satisfied with what I do. Then perhaps you can ask them to nominate a few of the customers, a few potentially successful customers, and then you interview these customers. And I don't say that you need to analyze that for thesis versus post-PhD, but I think it would, as long as you go to the all effort of recruiting, I think it would add value.
I think that could be well written.
And the last comment, and it's a very short one, you present an argument with which I fully agree about. You need a you don't need a standardized assessment procedure, you need general assessment guidelines. Fine, and I don't argue with that. You might still, in addition to that, think a bit about the potential added value of adding perhaps a few quick checklists. In psychology, in psychological intervention, sometimes we use questionnaire checklists, not long, lots of them, not long ones, and not for diagnostic purposes, but just as a guide to discussion. And in your case study, it could be really quick to fill out a checklist about life roles, life satisfaction in different areas.
That's it, and that's kind of what, that's, once I get the feedback, it's possibly, I was kind of thinking a way that it could be structured, possibly with points relating to aspects of the assessment, or possibly a little checklist or something like that, to get the OT thinking about these things.
Because I was thinking about the case study where there's the OT with a non-culturally sensitive intervention. If he thinks that customer needs to work on finance, but he gets the checklist completed saying that the customer is fully satisfied with his finance and food, then he might start thinking and maybe reassess his own assessment.
Absolutely.
These were reflections that I
So you mean like have a life satisfaction scale, short one?
What are, I don't know, what are the key life roles that you value, and a couple of key area of life satisfaction, the key obstacles that you encounter, the key area of, that are challenging for you because of your illness, and just something quick that he can fill or she can fill before coming into the meetings. And
also with this too, an OT can say, no thank you, I can do without this one, that it's not.
It would depend on the service. I mean, some service may mandate this as something that needs to be used. Some services may say this is available if you would like to look it up. But mostly the way that OTs work in public mental health anyways, I think that you have the freedom to find, to look for tools, and as long as you can say that they're relevant. and that they'll actually add, to your practice.
And I think, again, like what I was saying earlier, if we have someone from OT Australia on board from the beginning, who will sort of feel like they're part of the process, it's more likely to be promoted. And
absolutely, I'm going to need to work closely with them, I think. And I think they'll be very happy to, I think.
yeah, anything Indigenous they will, given the goodwill.
I was just wondering if OTs have what you think would be a good generalist mental health assessment tool for everybody, or is there nothing there?
We use, so every OT would in mental health do some form of functional assessment.
Right.
It will look different from service to service,
Okay.
the structure of the assessment, but it will cover the same basic things of, what does this person do every day, and what,
Is that a good tool from your perspective, what you would use generally?
It is. It's just, it's just kind of like a standard, for example, I suppose if someone was to come in with some kind of physical injury, there'd be a standard assessment that the doctor would use, I imagine, when they come into emergency, they have to look at this stuff. But they wouldn't all look the same in every hospital or in every service. It's kind of the same thing with OT. So you've got to be looking for the same things, but they'll just look slightly different.
Yeah. I guess just some of what you're describing sound to me like things that would be excellent for most people with mental illness.
They are. They are. This is the thing. This is something that we do every day, functional assessment, all the time. Very, very much part of what we do. But yeah, it's just that, in what I've noticed is that it's got to be sensitive to the cultural background of the individual. It's not at the moment. And I think that has a ripple effect.
That's one. Yeah, that's great.
Yeah.
Okay, I think that's enough. Right. Could I ask people to leave this room and panel members to be discussing, and we'll give you a recommendation.
Okay, thank you. Just wait outside.
No worries.
Thank you. Thanks very much.
Well done.